Okay, so let's move on to the thyroid gland and thyroid diseases. So this image is showing you the spectrum of what can happen with thyroid hormone, right? So euthyroid means, okay, you have a normal functioning thyroid gland and you have a normal level of thyroid hormone in your bloodstream. As we go to the left, you have excessive thyroid hormone, namely T4, in your circulating bloodstream. And as we get right to the left, you have such an excessive amount of thyroid hormone in your bloodstream that we call it a thyroid storm. So think of a thyroid storm basically as just much too much circulating T4 in the bloodstream. Okay, so I know that the thyroid gland produces T3 in small amounts and T4. Those are the main thyroid hormones. So if I'm referring to T4 more than T3, it's because it's produced in much higher levels. Okay. Okay, on the right, hypothyroidism. So the thyroid gland, for whatever reason, is making less T4 than it should be. Okay, so we have hypothyroidism, reduced levels of T4 in the bloodstream. And if that gets to be profoundly low, we'll call it myxedema coma. Okay, and I'll talk about myxedema a bit more on a following slide, but just think of myxedema coma as the thyroid levels are just so low that it's causing extreme symptoms. So just like thyroid storm on one side and myxedema coma on the other. In actual fact, sometimes we call hypothyroidism myxedema. Okay, so they're interchangeable a bit, but we'll reserve myxedema coma for severe hypothyroidism. Okay, so let's talk about thyroid hormone, whether it's deficient or excessive in the bloodstream. So hypothyroidism is definitely more common. And in fact, it's extremely common in women and relatively uncommon in male. So this is another condition where females by far get hypothyroidism much more than males do. And it's a reduction of circulating thyroid hormones, T4 and T3. And it's typically caused from loss of thyroid gland function. So inflammation of the thyroid gland leads to destruction of the thyroid gland, which then leads to a reduction in circulating T4 and T3. And the most common cause is an autoimmune disease called Hashimoto's thyroiditis. Okay, so the inflammation term comes from the fact that it's thyroiditis. So it's inflammation of the thyroid gland from an autoimmune condition. Okay. So what's going to happen in hypothyroidism? By the way, uh, hypothyroidism from pituitary failure and then decreased levels of TSH that then are unable to stimulate the thyroid gland, that would be relatively uncommon. And we would call that secondary hypothyroidism. So Hashimoto's disease, which is by far the most common cause of hypothyroidism, is a primary hypothyroidism. It's a primary thyroid disease. Okay. So what's going to happen as the circulating levels of T3 and T4 are diminished in the bloodstream? Well, the negative feedback to the pituitary gland isn't going to happen. And you're going to get increased secretion of TSH from the pituitary gland to try and stimulate this thyroid gland that isn't functioning properly to to make more T4 and T3, right? So we can actually measure TSH in the bloodstream to see if it's at a normal level. So let me give you an example. If someone isn't making T4 and T3 hormones because they have Hashimoto's thyroiditis, the TSH is going to be very elevated because the T4 and T3 didn't feed back to the pituitary gland to turn off secretion of TSH. And now the pituitary gland is saying, I'm going to produce tremendous amounts of TSH to try and get this gland to make thyroid hormones. Okay? So TSH is going to come up because it's a blood test that we do to monitor the thyroid gland. Okay? And TSH levels are typically very elevated in hypothyroidism because that's the response that the pituitary gland is doing to try and make the thyroid gland to work. Okay, what about hyperthyroidism? So hyperthyroidism is excessive thyroid hormone in the bloodstream, so T4 and T3. So we're not going to talk about the effects right now, we'll do that later. We're just talking about the loops, the feedback loops. Okay, so I have a lot of T4 or T3 circulating in my bloodstream. That's going to go back to the pituitary gland and tell the pituitary gland to shut off production and secretion of TSH. So I'm going to actually have a low TSH if I have too much circulating thyroid hormone. What's the most common cause of hyperthyroidism? Again, it's an autoimmune disease called Graves' disease. Okay? So Graves' disease is an autoimmune disorder where antibodies stimulate the TSH receptors on the thyroid gland. So the antibodies are almost pretending to be TSH and they're stimulating those receptors, and what happens is excessive production of T4 or T3 in the bloodstream. And then that feeds back to the pituitary gland and turns off the pituitary gland to produce any more TSH. So what are we going to see in hyperthyroidism? We're going to see elevated levels of T4, maybe elevated levels of T3 if we check that one, and very reduced levels of TSH. Okay, let's go into a bit more detail about the thyroid hormones. So there's two thyroid hormones that are secreted by the thyroid gland. So T3 and T4. Now T4 is going to be much more important, and it's secreted in much higher levels into the bloodstream. Now for synthesis of thyroid hormones, you need iodine. And that's typically why you're going to see many products that we eat have iodine added to them. For example, your salt that you purchase at the store will have iodine within the salt. Okay, iodized salt. Okay, and you can check it on the box. They'll have some iodine added to it to make sure that people get enough iodine in their diet and they can synthesize their thyroid hormones. So if there's one molecule or element that I would remember for thyroid hormone production, it's iodine. Okay. What's the overall function of thyroxine in the body? Well, it basically affects almost every cell in the body, and we'll get into that. And it regulates body metabolism. Okay, so if you remember that concept, it will make sense when we're talking about low thyroxine in the bloodstream, meaning hypothyroidism, and high thyroxine in the bloodstream, meaning hyperthyroidism. The other thing to remember is thyroid disorders are much, much more common in females. And I'm sure I'll mention that again because by far women are affected more, in particular, to hypothyroidism. So low thyroid levels in their bloodstream. Okay. Most thyroid conditions are primary thyroid disorders. So it's not usually the pituitary to blame. It's the thyroid gland itself that's either being destroyed by an autoimmune disease, and we'll get to that, called Hashimoto's thyroiditis, or it's a condition called Graves' disease that's overstimulating the thyroid gland, again, with autoantibodies. Okay? So it's rare to have a pituitary adenoma that's over-secreting TSH that is then overstimulating the pituitary gland. The thyroid gland. That's an uncommon way of having hyperthyroidism. It's usually a direct problem with the thyroid gland, whether oversecretion or undersecretion. Okay? And if you have an undersecreting thyroid gland, so hypothyroidism, what's going to happen? The pituitary gland is going to start making tremendous amounts of TSH because it's not getting that negative feedback loop. The TSH is going to go into your bloodstream and it's going to try and force the thyroid gland to make more thyroxine. The thyroid gland is unable to make more thyroxine because it's diseased. So all the stimulation from the TSH is going to lead to an enlarged, swollen thyroid gland called a goiter. And that's all a goiter is. It's just an enlarged thyroid gland. Let's look at the opposite, hyperthyroidism. So let's say somebody has Graves' disease and they have autoantibodies that are overstimulating the thyroid gland and making excessive amounts of thyroxine. But at the same time, all this overstimulation by these autoantibodies, they can also cause a goiter. So a goiter doesn't mean necessarily that you have a low thyroid or a high thyroid level in your bloodstream, thyroid hormone that is. It could be either. So understand the mechanism of how you get a goiter. So a goiter is from underproduction of thyroxine, reducing the negative feedback loop, so you get more TSH stimulating the thyroid gland, or it can be from Graves' disease, which is a condition where you have autoantibodies that are overstimulating the thyroid gland, and they both lead to a goiter, okay, that enlarged gland in the neck. You can also think of one other cause that causes a goiter. What about in countries where they don't get enough iodine in their diet? So if you don't have enough iodine, you can't make thyroid hormone. Okay, so there's going to be reduced levels of thyroid hormone in your bloodstream. There's going to be a loss of negative feedback to the pituitary gland. The pituitary gland is going to say, what's going on? I'm going to increase TSH levels to really stimulate the thyroid gland to make thyroid hormone. But it's unable to because it's lacking iodine. So that will also lead to a goiter, okay? Because the overstimulation from TSH is causing the thyroid gland to swell, but it can't make thyroid hormone because it's lacking iodine. And that is an extremely common cause of goiter in many, many countries around the world. We won't see it very much in the United States because we have iodine added to so many food products. Okay, so I will not have to spend very much time on this slide. Goiter. So what does it mean? Enlargement of the thyroid gland. It's not telling you anything about whether there's too much thyroid hormone in the bloodstream or too little thyroid hormone in the bloodstream. It's just telling you the thyroid gland is enlarged. Okay, we went through the two different ways that you can get, or the three different ways you can get a goiter. If you have Hashimoto's thyroiditis, which causes hypothyroidism, well, that's going to make the pituitary gland produce incredible amounts of TSH. That's going to overstimulate the thyroid gland. It wants to make it produce thyroxine. That's going to lead to a goiter. What about Graves' disease? The autoimmune disease that's overstimulating receptors on the thyroid gland, making excessive amounts of thyroid hormone in the bloodstream, but also in the process producing a goiter because it's stimulating it so much. Okay. And lastly, low levels of iodine. Low levels of iodine are basically causing low levels of circulating thyroxine because the thyroid gland cannot make thyroxine. That's going to lead the anterior pituitary to increase its levels of TSH and try and overstimulate the thyroid gland to make thyroxine. And that overstimulation also leads to a goiter. I wouldn't worry about the last one so much, the goiterogens. No, I would just understand what's a goiter. A goiter can be caused in the setting of low thyroid hormones in the bloodstream because of excessive TSH stimulation on the thyroid gland. It can be caused by Graves' disease because of overstimulation of the thyroid gland by these autoantibodies. And it can be caused by low iodine levels in the blood due to insufficient iodine in the diet. Okay, so let's just think about low levels of circulating T4 and T3 called hypothyroidism, and then we'll talk about high levels of circulating T3 and T4 called hyperthyroidism. And we'll get to the particular conditions, but let's just think about what's going to happen with low thyroxine in the bloodstream. So remember, thyroxine is responsible for regulation of body metabolism, and it basically affects every cell in your body. Okay, so if you have hypothyroidism, your overall metabolism is going to drop. Okay, so I really think of the thyroid gland as this little gland in your neck that is responsible for deciding on how slow or how fast the overall factory is going to work in the body. Okay, so if it slows down, okay, look at the first symptom. It's not the first one that comes to mind, but hypercholesterolemia. So the metabolism of cholesterol by cells has been affected. So it's going to lead to elevated cholesterol levels in the bloodstream. Okay, not the most common symptom or sign, but that happens, right? They have elevated cholesterol in the bloodstream. Weight gain, okay? You're not metabolizing as fast, so you're going to gain weight. Decreased fertility. Thyroid hormone is responsible for maintaining menstrual cycles. So it helps with the maintenance and the effects of estrogen and progesterone. So decreased fertility with hypothyroidism. Delayed deep tendon reflexes. So when we go to check someone's knee reflex or ankle reflex, it'll be slower and delayed. Okay. The feeling of sluggishness and tired, right? The body's metabolism has slowed down. The feeling of being cold, because thyroid is responsible for running a certain activity level in the body, and with low thyroxine, the body's metabolism has been reduced. You'll feel cold. Constipation, because thyroid hormone regulates the gastrointestinal tract, and with low thyroid hormone, it's going to be a sluggish gastrointestinal tract leading to constipation. Lethargy and fatigue, they basically mean the same thing, right? And patients can often be depressed as well as part of that lethargy fatigue. What about hyperthyroidism? Now I'm going to think of turning up the metabolism of the overall body. I'm turning on the factory much more. Okay, anxiety, tremors to your hands, tachycardia, feeling overly warm, right? So sitting in a room and peeling off your jackets, or going out in cold weather and you just don't need as many jackets on because you're hypermetabolic. Loss of weight, right? You're using more energy. Exophthalmos is where you have what's called proptosis of your eyes. So your eyes are bulging. And that's typical for Graves' disease, which is the most common cause of hyperthyroidism. Atrial fibrillation. So atrial fibrillation, because of excessive thyroxine, the heart rhythm is becoming overstimulated and patients develop atrial fibrillation. And lastly, again, decreased fertility. Why? Because the thyroid hormone is involved in regulating menstrual cycles. So whether it's low or high, it's impacting fertility. Okay, so let's look at hypothyroidism first. So Hashimoto's thyroiditis, which is an autoimmune attack on the thyroid gland, leading to destruction of thyroid tissue. Okay, so there's atrophy and destruction of the tissue, and what will happen is there'll be a reduction in overall T4 and T3 in the bloodstream. Okay, this affects women much more than men. Okay, look at 5 to 10 times more common than in men. And it's just a gradual destruction of the thyroid gland until somebody becomes hypothyroid. Okay, so what are the symptoms? What are common symptoms of hypothyroid? So I think of the thyroid gland as a small factory in the neck. It's regulating overall metabolism in the whole body. Okay, so if I'm lacking the hormone that regulates and stimulates metabolism all through my body, what's going to happen? I'm going to be weak. I'm going to be tired. I'm going to gain weight because of reduced metabolism. I'm going to be intolerant to the cold. So cold weather, I'll have 2 or 3 jackets on a relatively warm day because I'm cold intolerant. My metabolism is low. I could be hypotensive, lethargic, slow reflexes. So when we check patients' reflexes with hypothyroidism, they're not brisk, they're slow. And mental dullness. Okay? Those are very common symptoms of hypothyroidism. What will the labs look like? Well, if you have a low circulating thyroid hormone, T4, the pituitary gland doesn't get its negative feedback, and it produces excessive thyroid stimulating hormone, TSH, to try and force this diseased thyroid gland to produce more T4. Okay? And in actual fact, what can happen is there's so much circulating TSH, and there's so much stimulation of the thyroid gland that you can get a goiter. You can get swelling of the thyroid gland because the TSH is stimulating it so much. But it just can't produce enough circulating T4. Now, the other cause of hypothyroidism is if you have something wrong with your pituitary gland and it just doesn't produce TSH any longer. So if the pituitary gland doesn't produce TSH, then it's not going to stimulate the thyroid gland, and that will result in low T4 levels as well. But that is really uncommon compared to Hashimoto's thyroiditis. So I would spend much more time understanding why you get a low T4 and an increased TSH in hypothyroidism. It's very uncommon to have a secondary hypothyroidism from a pituitary disorder. Okay, so we spoke about the most common cause of hypothyroidism being Hashimoto's thyroiditis, that autoimmune disorder, typically in females, that destroys the thyroid cells, leading to a reduction in circulating thyroid hormone. How can we diagnose Hashimoto's thyroiditis? Well, we can do antibody tests on these two particular molecules. So antithyroglobulin antibody and another one called antithyroperoxidase antibody. I don't think you need to memorize those. I would just say, you know what, there's circulating antibodies that are destroying the thyroid gland. Okay, by far the most common cause of hypothyroidism. What else can cause hypothyroidism? Well, certain drugs that inhibit the thyroid gland, such as lithium. There's another one called amiodarone, which is an antiarrhythmic. They can inhibit the thyroid gland from producing thyroxine. Genetics can lead to hypothyroidism. So if there's a strong family history of hypothyroidism, well, through inheritance, the patient may have hypothyroidism. Thyroiditis. So women can develop inflammation of the thyroid gland after delivery. Okay, and when you have inflammation of the thyroid gland, that can lead to destruction of the thyroid gland, resulting in hypothyroidism. Okay, but just to keep things in perspective, Hashimoto's thyroiditis is by far the most common cause leading to hypothyroidism. Okay, and here's a list of symptoms and signs that occur with low circulating thyroid hormone from any cause. Okay, so whether it's from Hashimoto's thyroiditis or from a drug such as lithium that a patient is taking, or deficient iodine and you're not able to make thyroid hormone. These are the symptoms: the cold intolerance, the weight gain. Remember, the factory is shutting down a bit, right? Because the overall metabolism has dropped due to deficient thyroid hormone. The lethargy, fatigue, potential for cognitive deficits such as poor memory, poor attention span. Muscle cramps. Why? Well, thyroid hormone is responsible for maintaining muscle tone, right? So as it's becoming deficient, muscle cramps can occur. The constipation from the poor gastrointestinal functioning. The decreased fertility occurs in high levels or low levels of thyroxine. The puffy face, so that's that myxedema, right? The swollen legs as well, that's that myxedema, so excessive fluid that's developing. And also not metabolizing fats because of decreased metabolism due to low thyroxine levels. You can have excessive fat deposition, so a puffy face, swollen legs. You typically start to lose hair because the hair follicles need thyroxine to maintain themselves. And the nails become very brittle in hypothyroidism. Okay? Okay, how do we treat hypothyroidism? Again, this is probably just a reminder slide because I know I've said it elsewhere. Levothyroxine. Okay, so it's just straight thyroid hormone replacement. How do we monitor a patient that's on levothyroxine? We can do a T4 level in the bloodstream, or even easier, we'll just do a TSH level. So if someone is taking the proper amount of thyroid hormone, well, that's going to have a negative feedback to the pituitary gland, and the pituitary gland will secrete a normal amount of TSH. So we're looking for TSH levels in the bloodstream that are in the normal range for a normal person that isn't hypothyroid. Okay? Now, let's say someone forgets to take their levothyroxine for a month. What's going to happen to the TSH? In hypothyroidism, it's going to be elevated. The pituitary gland is going to turn on and say, I'm going to make lots of TSH to stimulate the thyroid gland. So when we see an elevated TSH, we know that there's not enough circulating thyroid hormone in the bloodstream. And we can adjust someone's levothyroxine level to bring the TSH back into a normal range. Okay? Myxedema coma is just another word for severe hypothyroidism, right? And it can progress to confusion and coma. If you think about the progression of the factory being turned off, that would make sense, right? More fatigue, more mental dullness, more confusion, and then finally a myxedema coma. Okay. Okay, so here's just an image of some changes that can occur with hypothyroidism. We'll go over much more on the next slide. But just remember the term myxedema is really a term that we reserve for hypothyroidism, right? And we reserve this term is because you can get edema of the legs, and you typically get very dry, irritated skin with hypothyroidism. So that's where the term myxedema comes from, the swelling and dry skin that occurs with hypothyroidism. Myxedema coma is much different. That is severe hypothyroidism leading to a constellation of symptoms that we'll discuss. Okay? Congenital hypothyroidism, which is the image on the right, is a lack of the thyroid gland producing T4 and T3 at birth or in the uterus as a fetus, right? And that leads to a condition called cretinism. And you can see the changes that can occur in someone who does not have circulating thyroid as a child, right? It's significant. So that is why we check a TSH before any infant is discharged from hospital. So we do a TSH and we do a test for PKU, which is an inherited condition that is very treatable with a diet. And cretinism, which is infantile hypothyroidism, very treatable with thyroid replacement. So this doesn't have to happen if this person was treated with thyroid replacement. Okay, so TSH and a PKU test is taken prior to discharge from hospital to screen for those two conditions. Okay, so let's work through this slide together. So let's just say someone comes in and they have hypothyroidism. Now, remember, primary, and by far the most common, by the way, is that the thyroid gland just isn't making thyroid hormone, say due to Hashimoto's thyroiditis. By far the most common cause. Okay, so when we do a blood test, we expect to see low levels of T3 and T4 in the bloodstream if they're hypothyroid, if they have hypothyroidism. Okay, because the thyroid gland just can't make the hormones. Okay, the pituitary gland is not happy about this. So it's going to produce excessive amounts of TSH because of the low thyroid levels. And that's exactly what we see on blood tests. A low T4 level and an elevated TSH level in the serum. Okay. Let's go to the secondary cause of hypothyroidism. This is much, much less common. Okay, let's say that there's something wrong with the pituitary gland, and the pituitary gland is just not making TSH. Okay, low levels of TSH in the bloodstream will result in understimulation of the thyroid gland, which will lead to low levels of T3 and T4 in the bloodstream. Okay, so if you have secondary hypothyroidism, okay, I would expect that not only are your thyroid hormones low in the bloodstream, but there's no negative feedback happening because the entire problem is from the pituitary gland. So there's going to be low TSH because the problem in the pituitary gland is the fact that those cells are not making TSH to stimulate the thyroid gland. Okay? Now, diagnosis of the most common cause of hypothyroidism are those antibodies that destroy the thyroid gland. We spoke about them, and that is in the setting of Hashimoto's thyroiditis. Okay? We can do an ultrasound of the thyroid gland, looking to see if there's a goiter, looking to see if there's cysts in the thyroid gland. Okay? It's not going to be helpful in terms of telling us what the thyroid hormone level is in the bloodstream. It's really just to look at the thyroid gland. Okay, so it's often recommended that thyroid tests be done in females over the age of 35, right? And in particular, if they have a family history of hypothyroidism, it's definitely a good idea to get a TSH blood test to see that it's in the normal range. Okay? So remember that TSH blood test is indirectly telling us that the thyroid gland is working normally. Because if your TSH is very high, it usually means that you're hypothyroid. You have low thyroxine in your bloodstream. Okay? If your TSH is super low, it typically means that you have hyperthyroidism because the thyroxine has gone back to the pituitary gland and turned off the production of TSH. Okay? Don't forget the negative feedback loop.